Good morning, my name is Paola Ochoa and I'm gonna talk about mutagenesis in norovirus response to Favipiravir treatment. Definition: chronic norovirus infection in immunocompromised patients can lead to malabsorption and other complications. Currently, no treatment has proved to be effective. Favipiravir is an antiviral medication that has been approved for the treatment of influenza in Japan and has been used by some as treatment for Ebola virus infection.
Did you hear about vomiting bug norovirus surging as COVID-19 restrictions lift? Want to know more about norovirus? Welcome to Fitnify, where we inspire you to live a healthy lifestyle. If you are new to this channel, don't forget to hit that subscribe button. And turn on notifications so that you don't miss any of our videos. What is norovirus? What are the symptoms? How is it transmitted? What are the steps to diagnosis, treatment and remedies? How to prevent norovirus? Noroviruses are a group of related viruses that are highly contagious that causes vomiting and diarrhea. People of all ages can get infected and sick with norovirus. You can get norovirus from an infected person, contaminated food or water, or by touching contaminated surfaces. Infection with these viruses affects the stomach and intestines and causes an illness called gastroenteritis, inflammation of the stomach and intestines. How do you know you have norovirus? The most common symptoms of norovirus are diarrhea, vomiting, nausea, stomach pain. Other symptoms include fever, headache, body aches. Norovirus causes inflammation of the stomach or intestines. This is called acute gastroenteritis. A person usually develops symptoms 12 to 48 hours after being exposed to norovirus. Most people with norovirus illness get better within 1 to 3 days. If you have norovirus illness, you can feel extremely ill, and vomit or have diarrhea many times a day. This can lead to dehydration, especially in young children, older adults, and people with other illnesses. Children who are dehydrated may cry with few or no tears and be unusually sleepy or fussy. Do you know how they are transmitted? Norovirus can spread very easily. You can catch norovirus from close contact with someone with norovirus, touching surfaces or objects that have the virus on them, then touching your mouth, eating food that's been prepared or handled by someone with norovirus. But how is it diagnosed? Diagnostic methods for norovirus focus on detecting viral RNA, genetic material, or viral antigen. Diagnostic tests are available at all public health laboratories and many clinical laboratories, and most use reverse transcription real-time polymerase chain reaction, RT-qPCR, assays to detect norovirus. The treatment and remedies for norovirus includes washing your hands frequently with soap and water. Alcohol hand gels do not kill norovirus. If you have norovirus illness, you should drink plenty of liquids to replace fluid lost from vomiting and diarrhea. This will help prevent dehydration. If you want to know more about norovirus, comment and let us know. Stay tuned for more health and fitness information videos. Till then, stay safe, stay healthy.
Applications in medicine. Preclinical data have shown that Favipiravir can induce mutagenesis and impair norovirus infectivity in mice. We use Favipiravir to treat chronic norovirus infection in a 40-year-old man with common variable immunodeficiency. We administer 6,000 milligrams of Favipiravir on day 1 in 3 divided doses, followed by 1,200 milligrams twice daily. We used doses that had been evaluated in a trial of treatment for Ebola virus infection.
Orientation to the molecular structure of norovirus. Norovirus is the leading cause of acute viral gastroenteritis and is responsible for up to half of all foodborne disease in the U.S. One way scientists attempt to understand the virus is through analyzing its structure. Early visualizations were made using immune electron microscopy, and based upon these observations, these viruses were referred to as small, round, structured viruses. Over time, an increased understanding of this virus has been obtained, and they are now called noroviruses, a member of the Caliciviridae family. The diameter of noroviruses is approximately 38 nanometers. This is 50 times smaller than the length of E. coli bacteria and 200 times smaller than the diameter of a red blood cell. These viruses consist of genetic material in the form of a single strand of RNA and a capsid, which is a protein coating that surrounds the RNA. The capsid is important because its interaction with the host cell initiates infection, and it protects the viral RNA. The capsid is composed of 180 molecules of a single protein. Each molecule is called a monomer. The monomers self-assemble into dimers, and these 90 dimers in turn assemble into the virus capsid. The capsid is made of two basic structural components, a shell and a protruding region linked by a flexible hinge. The shell, also referred to as S, is the structural core of the virus that surrounds the genome. It consists of the combined shell domains of all the monomers. Likewise, the protruding region called P consists of the combined protruding domains of all the monomers. The P domain is subdivided into two subdomains, P1 and P2, with P2 being the outermost subdomain. Elucidating the structure of the norovirus capsid contributes to our understanding of host susceptibility, the host immune response, and strain specificity of these viruses.
Pros and cons. Pros. The patient's diarrhea and the use of adjunctive loperamide decreased his body weight increased and the norovirus viral load decreased. Cons. An increase in serum levels of aspartate aminotransferase, alanine aminotransferase, and alkaline phosphatase on liver function testing prompted a treatment interruption on day 19, and the patient's gastrointestinal symptoms promptly relapsed. Reintroduction of Favipiravir was associated with rapid deterioration in liver function, test results, and treatment interruption on day 6.
Transmission of norovirus. Norovirus illness has been called by several names, including the stomach flu and winter vomiting disease. Noroviruses are important pathogens around the world. They are believed to be responsible for a large proportion of all gastroenteritis outbreaks worldwide. Approximately 21 million cases are estimated to occur each year in the United States. They are also the most common cause of foodborne illness in the United States. As much as half of all food-related outbreaks in the U.S. are believed to be caused by noroviruses. The virus needs to be taken in through the mouth to infect a person. It incubates in the gastrointestinal tract for 12 to 48 hours and most likely multiplies in the small intestine, causing tissue damage, which leads to the symptoms. The most common symptoms of norovirus infection are vomiting and diarrhea. Other symptoms include abdominal pain, nausea, fever, and headache. The illness usually resolves on its own without any long-term effects. Sometimes, people with certain underlying medical conditions can have more serious disease. The elderly are particularly susceptible. People acquire the virus through direct contact with people who are sick, as well as coming into contact with surfaces, foods, or water contaminated with the virus. The virus is shed in the millions to billions in stool and vomit, and the virus particles can also be aerosolized over several feet when a person vomits. It may take only 20 virus particles to make someone sick. Though shedding is highest during a person's symptoms and just after symptoms resolve, people have been known to shed the virus for weeks after they feel better, potentially exposing others. It is important to note that not everyone is susceptible to any one strain of norovirus. A subset of the world's population has a genetic makeup that prevents particular strains of the virus from being able to infect. It is suspected that not everyone who is infected with the virus shows symptoms. These viruses also have a high mutation rate, and new strains emerge every few years. Coupled with the fact that norovirus infection does not create long-term immunity in most people, a person can be infected multiple times over the course of their life. Additionally, the viruses can persist on surfaces and in food and water, and are not completely inactivated by most common disinfectants, sanitizers, and food processing and preservation methods. This complicates efforts to prevent and control the spread of the virus. People who study outbreaks, also called epidemiologists, look at the distribution of cases as they develop over time. This helps to determine the original source of infection. For example, in this figure, a single vomiting incident followed by a contamination of a surface triggered a cascade of disease. In short, because the virus is shed in large amounts in vomit and feces, is persistent, and is resistant, it's clear how a norovirus outbreak can result from one ill individual or contamination event.
Issue applied in Ecuador. There is a high increase of norovirus infection and disease in Ecuadorian children, but we do not have clear evidence for acquired immunity. In Ecuador, 66% of children under 3 years of age experience at least one human norovirus infection, and 40% have had two. Conclusion. In summary, despite the presence of complex coexisting conditions, the patient in this case had some symptomatic response to favipiravir treatment, along with evidence for selective pressure on the infected norovirus population. Further study of favipiravir for chronic norovirus infection should be considered. Thank you.